Hello, everyone, and welcome to the Vegas Legal Magazine podcast. I'm Mark Fierro. Tyler Morgan, publisher of Vegas Legal Magazine, has the day off. Thank you so much for joining us today. There is some cause for optimism in the fight against the global spread of the COVID-19 virus. The numbers, including those in the United States, are beginning to level off and indeed dropping in much of the country. One of the names associated with the deep dive into the study of the pandemic locally is Dr. Brian Labus, assistant professor of epidemiology and biostatistics at our own UNLV. His research focuses on communicable diseases surveillance. Dr. Labus is registered environmental health specialist through the National Environmental Health Association and teaches courses in infectious disease, epidemiology, and outbreak investigation. Dr. Labus, thank you so much for joining us today.
Thanks for having me.
You know, what are we to make of these numbers? Because it does look, as the nation as a whole, it's beginning to drop off, but there are a bunch of hotspots that are doing as bad or worse than they ever have.
Well, the outbreak kind of moves from place to place. One state seems to be worse for a little while, and then they finally pay attention and get it under control. And then we see it flare up in other places. And that's entirely based on our behavior. South Dakota was one of those places that wasn't seeing much disease, and they decided to have the Sturgis motorcycle rally, and they're seeing a lot of cases after that. So that's kind of driving it. Every state has their own outbreak. If you look nationwide, we're seeing a bit of a decline in cases. But if you look at individual states, there are some that are still having a terrible time with this outbreak right now.
You brought up Sturgis, and I think people are taking great comfort in the fact, well, there's not a bunch of people dying. Well, if you get it in Sturgis, then you've got a week before you start to show any symptoms, if indeed you are symptomatic. But then you're going to give it to somebody else. That's going to take at least 2 weeks. Even if things go badly and you end up in the hospital, it's going to take you 6 weeks to pass. We can keep you alive now. So you're talking about first week of October before you really start seeing a death toll from that, isn't it?
Yeah, that's entirely true. And that's the problem we've had getting the public to think about those deaths in Southern Nevada. If we're doing something today that's causing a lot of transmission, we will not see a death from it for quite some time. And so the deaths are a bit removed. And then when you see the spike in deaths, everybody says, oh, there's a huge problem. Well, no, there was a huge problem 6 weeks ago and you were basically ignoring it. And that's why we had that huge problem. So that delay is quite a challenge, but that's not just for the deaths. It's for hospitalizations. It's for the cases themselves. It's 3 weeks between when you get infected and when you show up in our database usually, because it takes time to get sick and time to get tested. So there's always a delay in the data, which makes people not as concerned about what's going on right now.
I believe experts like yourself call it lead time bias. And it really is throwing off our observation, what we think is safe and isn't safe, isn't it?
Well, yeah, it's basically just a delay we're looking at what happened 3 weeks ago. And it's essentially like trying to drive a car by watching a video of where you were 20 minutes ago. You really can't pick the direction properly. You know where you were, you just don't know where you are now. And it's really hard to plan and move forward when we don't know exactly where we are right now.
A very wise man once said, one of the most dangerous things that you have to take note of is that which didn't happen. And I look at what Governor Sisolak did. Big shutdown. Everybody screams. Naturally, they did. It impacted everybody's lives. It threatened our economy without any question. But we aren't Florida as a result. We're not Arizona as a result, are we? We didn't see the piles. We didn't see the unclaimed bodies being buried in trenches the way New York did.
That's a problem we have in all of public health. If we do our jobs properly, nothing happens. And people say, well, why did we spend all that money on it? Well, we didn't want something bad to happen. And people don't really celebrate things that don't happen. That's a huge challenge for us. And it's been the same thing here. We knew that if we did everything right, people would complain that it was all a waste of effort because nothing happened. Well, that was exactly the idea. We don't want people to get sick. We didn't see an increase in some of the things like that. We didn't become, like you said, New York or Florida. Those are good things, but people don't recognize that. You can only look at the bad things then, not the things that didn't happen.
One of the great challenges, and it's something that every single official throughout the country, anybody of any prominence had to deal with, and that's back to school. Now, I saw an article from you earlier that's saying, kids don't carry the virus the way adults do. But once you get into into that 10 to 20 age range, it's kind of you're on the spectrum, and you're almost an adult until you get to college age kids. Bringing kids back to college, we've seen just a massive uptick in just the last few days nationally, haven't we?
We have. It's kind of the problem where you bring a group of people together who are really low risk for disease. They're at risk for severe disease. The college kids are not the ones that are winding up in the hospital or winding up dying. To them, it is a mild infection. But a lot of people getting infected can really drive this outbreak over time, and that's a huge concern. We brought everyone back to college campuses, had them go back to their classes, and almost act like things were kind of back to normal, and they really aren't. And that's really provided an environment where this outbreak can flare up.
Here is the nightmare scenario in my mind, and it's what we naturally tend to do. You're away from home for the first time in your life. You're at college in another state or in another part of your state. You get sick. Maybe you're asymptomatic, but you know you've got the disease. Maybe you have light symptoms. But the first thing you do is think to go home, and that's the worst thing you can do, isn't it?
Well, it can be. I mean, the problem is you don't have the supportive environment when you're in college. You don't have somebody taking care of you. Your mom's not there anymore. And of course, that's where you want to be when you're sick. And when you wind up going home, now we've taken that disease from that campus where it's kind of exploded and spread it back to a bunch of towns. That's the same problem we have with not just colleges, but when we have any sort of event. If there's a NASCAR event, or like we talked about the Sturgis Motorcycle Rally, or even coming to Las Vegas as tourists, people can be infected here and then take it back home to other places. And so we have to think about how disease easily moves around the country anytime there's a cluster anywhere.
These super spreader events, that's what we really have to look out for, and what Las Vegas could have been the epicenter of, 100 of them every single night, had we not shut down entertainment. Tell us how these super spreader events run, because that's really what's driving the numbers now, isn't it?
And we see that in a lot of outbreaks. We saw that with SARS. We see that with a lot of respiratory disease, where most people maybe infect one other person, and then you get one person in the right environment, and they can infect hundreds of other people. And that's a really great way to make an outbreak explode if you have some of those super spreader events, because it goes just from 1 or 2 cases to hundreds overnight, basically. So it's just the right environment, basically everything coming together to give the perfect opportunity for the disease to spread. You typically have somebody who's asymptomatic or pre-symptomatic right before they get sick. They're highly infectious, and the environment is one where people aren't social distancing or taking the right steps. One we've talked about a lot in public health is early on in the outbreak, there was a choir practice where one of the people came and wound up infecting pretty much everybody else that was there in Washington. And this was early on before we had mask mandates and all those things, very early on in the disease. So we weren't even telling people really what to do with social distancing, but we know that things like singing and chanting and screaming are going to spread more virus. And so it was just the perfect combination, kind of that perfect storm that allowed a lot of people to be infected overnight. So instead of that person infecting one other person or 2 people that we can handle, we've now got hundreds of sick people in the community spreading it to others.
One of the examples that you use in the efficacy of masks involves a very simple, very, very straightforward study, and that is the hairdressers. They're in close proximity to a set of patients. Tell us the background on that, and tell us why that's so important relative to the importance of masks.
So in Missouri, there were a couple of styling salons where the hairstylists came to work while they were infectious. And they were around about 150 people over 2 or 3 days, but they were wearing their masks. And that basically meant that any of the virus that they were spreading, even though they were in close contact, was kept in that mask, kept close to their mouths and not being put out into the air. And they didn't infect a single person out of those 150 people that came in. That's what we want to see happen. The masks are there so that we can reduce the transmission of disease. In that case, it didn't infect anybody. That's the ideal situation, but it's really reducing that risk. We don't expect it to be perfect like we saw there, but that was a great example of masks actually working while businesses reopened to stop disease transmission.
We loved your article, a few choice words about the mask. What is it that makes people think? I still can't get this right in my mind. Is it that they believe that Europe is in on this they're in on this great conspiracy that Asia, that Japan and Korea, they're in on this conspiracy to impact the presidential race. I don't understand why people insist that they have the right not to wear a mask.
Well, that's a difficult thing. It brings a lot of things together. Part of it's just the political polarization of our country. And public health tends to be a very liberal field. So it aligns with the Democratic Party more frequently. And so as soon as people see that you're doing things for public health, they assume it's a left-wing plot to do something to the right. And that's not true at all. We would have to basically get the entire planet in on some conspiracy. It's hard to keep a secret between two people, much less billions of people worldwide. It just doesn't make a lot of sense. But when you're talking about conspiracy theories, it's usually not based in logic and science. There's a lot of misinformation out there. And if you look at the different posts that you see around the conspiracy theories, it's easy to pick them apart. But as soon as you discredit one thing that's in there, another thing pops up to take its place.
You can hear the banjo music playing in the background in a lot of those posts.
Sometimes it's really interesting. I mean, just the different ones that are out there. Some are very political. Some are saying that it's not necessarily the president. It's just the government trying to tell us what to do and take control of our lives and all those sort of things. And so it comes from a lot of different angles. And it's just very challenging to deal with because we have to deal with that instead of the real problems.
Here's a left-wing plot for you. This will boil down the left-wing plot for you. The notion that masks somehow don't work. Hong Kong, they adopted masks immediately. They're experiencing 7 deaths per million. South Korea, big on masks, 6 deaths per million. Japan, big on masks, and they didn't shut down the party. They kept going, but they believe in masks. 9 deaths per million. The US, not big on masks, 522 deaths per million.
Yeah, that really shows that masks work. We also see the same thing in the United States. If you look at communities that have had mask mandates, they typically are seeing lower rates of disease than communities that have not had those mask mandates. So the evidence is there that they work. I think people have had a problem and a little confusion about the way we've talked about masks. Early on in the outbreak, we said, don't wear masks because we want people taking all the medical supplies from the hospitals. Yes. And they weren't going to protect the wearer. The masks we have today are exactly the same. So back then we said, these masks won't protect you, don't wear them. But we're saying the same thing now. People are hearing it differently. The masks won't protect you. They protect everybody around you. It's like covering your mouth with a Kleenex when you sneeze or cough. It's not for you, it's for everybody else. And that's what we're telling people now. And so some said, well, you keep changing your minds. No, we have a widespread disease now, and so masks are appropriate. Back then, they weren't. It was a different situation, a different time, and masks really wouldn't have done much to stop the transmission early on when we were making those sort of recommendations because they were taken away from hospital personnel, which was our big concern.
We've produced, my firm, Fierro Communications, has produced a video that we'd like to show right now, and we'll come back right after that. Las Vegas needs a hero, someone to hunt the COVID-19 virus down and kill it. That hero is you. Studies have shown that wearing a mask, hand washing with soap, and wearing gloves keeps the virus from spreading more than 68% of the time. Wearing a mask means stopping the spread. Wearing a mask is heroic because when all of us wear masks, all of us go back to work. All of us be a hero. Put on the mask. In World War II, probably the greatest threat to human life in modern times, the question was, Daddy, what did you do in the war? Americans sacrificed, they rationed food, they sent their sons off to risk their lives. Roughly 405,000 Americans died. That took 4 years. About 8,500 people died each month on average. We've lost nearly 180,000 Americans in a matter of 5 months, 3 times the rate. 3 times the rate. And there are some people who just refuse to get it. You know, one of the things that we saw in that spot as a result of that is that people who don't believe in masks will wear masks if they believe that it will put Americans back to work.
And
we can't go back to work. We can go back to work. The director of the CDC, Robert Redfield, said if 90 to 95% of all Americans wore masks, it would have the same impact of shutting down the economy entirely, but we wouldn't miss a beat. Everybody could go back to work.
Right, and we tried to have that as our reopening plan, and it was a huge challenge to put that in place in the state of Nevada. Governor Sisolak said that he was, he had gotten the advice that everyone should wear masks, but he was concerned about putting it in place because he didn't want to put frontline retail workers basically in harm's way. And we had security guards killed trying to enforce mask mandates, and he didn't want to cause that sort of problem. And so because people were so violently opposed to masks, we were reopening the community with a lot of that, without those safeguards that would have allowed us to keep disease under control.
So there's been some word as of late about vitamin D, the efficacy of vitamin D on both increasing macrophage and helping to shut down that cytokine storm that is what it essentially takes so many people out. Where do you come down on that?
Well, I think the first thing we saw with vitamin D is that people who are vitamin D deficient seem to have a worse time with the disease. So that makes sense that you have some sort of nutrient deficiency and you're going to be more likely to get sick or wind up in the hospital. And so getting people on supplements to get their vitamin D levels back to normal makes perfect sense. But that doesn't mean that a bunch of extra vitamin D on top of that is going to prevent the disease. And I think people have combined those two ideas into one. Every time there's some sort of outbreak, there will be a bunch of natural remedies that come out, supplements that are recommended. People will say, pretty much in every outbreak, they're going to recommend vitamin C. And we see those things time and time again without the scientific proof. And I think that's kind of where we're at with vitamin D. There's some potential that it could do something, but we really have to have the science behind it to start making those recommendations. We know that we can help people who are deficient, but we don't know if giving a bunch on top of somebody who's has a normal level of it is really going to make much of a difference.
I would call people's attention. There's a great, it's very informative Radio Lab, July 30th of this year. The individual episode is called Invisible Allies. There's a couple things that they found, and that was they had a large number of homeless people that they were helping in Boston, and they thought, well, here comes the wave. We're all going to die. We're all going to get this. No cases. They thought they had 0 cases. When testing finally arrived, they found out that they had 40% rate of infection, but 0 that were showing symptoms. And it's because street people, think about it, they don't have access to hygiene. They're not wearing masks. They're living on top of each other in some cases, but they're in sunlight constantly, which helps vitamin D. Another thing they pointed out is think of the elderly. Why did we lose so many elderly? Well, you think, you get up there and hear something is going to take them. Then you look at the absorption rate of vitamin D in seniors, it's 30% of what it is in a young person. And the other big box to check off is our friends who have darker skin have a tougher time absorbing vitamin D. And once again, there is a portion of the population that has just been crushed. And you said the most important words, it will not prevent you from getting anything. That will not happen. But it seems as if it may have kind of a mitigating factor on the possibility of that cytokine storm that kills so many people in ICU wards across the country.
We see a lot of things like that in every outbreak. Something looks really interesting, and we then do the science to find out if that really is showing what we could show as. In this outbreak, the same thing. The whole mess with hydroxychloroquine started because there was one small study that showed that it worked. Well, it was on 10 people or so, and we said, well, that's an interesting finding. Let's do some real research on it. And it turned out not to be the case. The same thing is true with vitamin D or any supplement. Yes, there is some circumstantial evidence there that it may work. And so it makes sense to then start trying it in a controlled clinical setting to see if that's really what it is, or that's really almost a marker for something else, or there's another factor going on there that we just didn't quite understand. So those things, anytime we see those general observations about the community, those are great places to start. Researchers love seeing those kind of things because it means we can conduct a real trial. The problem is people want to jump ahead and say, oh, let's give all these drugs because there was a tiny thing that said it may work. The problem is for most of those things, there's a lot of downsides too. Vitamin D, I'm not really worried about that causing a lot of problems, but hydroxychloroquine and other medications that have been proposed have negative side effects as well. And so you can't just medicate the population with it and hope that it works without paying attention to the side effects.
There were two numbers that stuck out with me right at the beginning when they started talking about vitamin D. There was two big observations. One was that when they looked at the profile of those people who ended up in ICU, approximately 80% of them were deficient in vitamin D. And when they looked at a group of people who were asymptomatic, that 90% of them fell into the category of normal vitamin D. I think it's just fascinating. There's another thing that they brought up in that same podcast out of WNYC, and that was a group of Indian national doctors who were practicing in London were wiped out by that initial surge of the disease that was such a scary time. But this could have been the worst thing in the history of the world. Well, all of their docs who were working alongside bright white Caucasian docs died. They were simply taken out. And the Indian doctor said, listen, just as a prophylactic measure, just in case there's something to this, everybody start taking vitamin D. All the doctors that belonged to this association in London who were Indian nationals took vitamin D. Not one became symptomatic after that. No more deaths.
Right. Well, there's a couple ways to look at it. So you're looking at it as if you give the supplements on top of normal, that's going to protect it. I think the way I see it is this could be a huge problem for people with vitamin D deficiency. And if that's a common problem, then if we give supplements community-wide, it will bring those people back up to normal, which reduces risk of the serious disease. So same idea, but looking at it a little bit different way. If we can identify the people who are vitamin D deficient and get them back to normal, that's going to reduce their risk. It might not do anything for everybody else, though.
And understand, just to underline it, nobody is claiming that it does anything in any way, shape, or form to prevent anyone from getting the disease.
Right, and that's one of the challenges we have. A lot of people get this disease, and even by age, you see big differences in the rates of hospitalization and the rates of death. Little kids still can get infected with it. They just have a much lower chance of having a serious disease if they are infected. And I think we see that with a lot of different diseases, though. We see those differences by age where older people are just as likely to get infected as some younger people, but they're much more likely to wind up in the hospital as a result.
You know, one of the scary things is that early on, when you compare this to the timeline of the great pandemic, the great influenza of 1918, is that they got a tremendous break during the summertime. A lot of ultraviolet light, people were out in the light, people were moving around, and the numbers decreased and the severity of the virus actually let up a little bit over the summertime. What if this is our let up? What if this is as good as it gets? This is summer. What happens when we plunge back into those colder temperatures and shorter days?
Well, it seems like the real difference between the summer and winter is the amount of time people spend outside. We see that with a lot of diseases. If you're in indoor spaces, in cramped quarters, that's when you're exposing other people to the disease. Simply just going outside is what makes the difference. It's not the fact that there's UV light or a temperature difference. It's the fact that you're outside and you're not on top of people. You're spread out more and there's less transmission of disease in just outdoor spaces. And so that has a lot to do with it too. Even if you ignore every other possible environmental factor, the fact that people are outside and not spending all their time indoors in close quarters makes an enormous difference. And I don't know that we've seen that much of it with COVID. As we go into the fall and people are spending time together indoors, that's the concern. But we're doing everything we can to keep people from having those gatherings and keeping bars closed and a lot of entertainment venues and things like that, so they don't have an indoor place to congregate no matter what time of year it is.
What do you make of the progress the governor's group has made so far? Tell us about what's going on from your perspective.
Well, I think one of the challenges we have with public health in the United States is that every state does their own thing. There are state laws that apply to Nevada that are different than California, different than Arizona. So the fact that the Western state governors have gotten together and talked about doing some things the same way gives us a much better regional response to these sorts of issues. Within the state, there's a lot of different committees that are doing different things. We started out with the idea that we basically were treating the entire state the same way. It was brand new. We really couldn't say, well, these places should be treated differently. Now that we've had a lot of experience with it, we can do things differently in Clark County than we would do in Washoe or one of the very rural areas that are experiencing this disease. They may be able to open things more safely than we can. We have those sort of differences. The fact that they're looking at those things on a county level, I think has been a good change that we've seen. To me, the most successful part of this is that I've seen our state use data to drive the decisions. It hasn't been based on just the desire. We're not trying to just wish the disease away. In making decisions about moving to next steps and when we open and close things, data has been a big part, looking at numbers every single day, trying to understand what's really going on and making decisions based on the numbers and just hoping that things will be better.
You know, one of the strangest parts of this virus that really is one of the most frightening parts for the long term is that it doesn't appear as if there's any permanent immunity that we've seen yet, is there?
Well, I think it's too early to really say. It came out from CDC last week that said after about 3 months, you should still be immune. The problem is we don't know what happens 6 months, 12 months, 10 years down the road because we've only had this virus around for a few months. The only way we're going to know what happens in 10 years is to wait 10 years. We've seen decreasing levels of antibodies in people as we test them over time, but that's to be expected. After your infection, antibody levels will decline. But we don't know exactly where we get to where you're likely to be infected again. For other coronaviruses that cause the common cold, those don't last too long, and you can get the common cold every single year when those antibodies wear off. So I think that's really the concern, that it's going to be like that, but we really just don't know at this point. And it's really hard to plan for what's going to happen in a few months if we don't understand the immunity piece of it. That's also a huge challenge for vaccine development because the vaccine development is based on building your immunity. And if that wears off 3 or 4 months, you would have to get continual vaccines to make sure that you remain protected against it. We just don't know because we have not had enough time to have those experiences. It's just a giant question mark still. And it's very difficult to plan when you don't know really what you're dealing with biologically.
There were great hopes, and the White House put it out as if it was a breakthrough the other day, and that's convalescent plasma. It's an approach that's been around for more than 100, well over 100 years. What is it? Size it up in terms of a breakthrough, if you would.
I don't know that I would say that it's a breakthrough. It's not going to prevent the disease. It's the idea that if you're in the hospital, antibodies from another person already successfully fought off the disease, that will help supplement your immune system and give a better chance of having a more mild disease and a better chance of survival. I don't know if I would say it's the breakthrough that we've all been waiting for. It's something we're talking about for months. Very early on, we said, you know, this is one option. This is something we've done before when we don't have a treatment, we don't have a vaccine. It's something that we can use. But it is a bit of an unwieldy process. It's something you have to do in hospitals. It doesn't apply to the population at large. It's something where we're going to be able to take hospital patients and keep alive, hopefully, but it's not going to stop this outbreak because you're talking about a small percentage of all the cases anyway.
Let's look forward to the possibility of a vaccine. When is that possible? They've talked about the end of the year, the beginning of the year, spring of next year. What's the word that you hear?
Well, most recently, we've started the clinical trials. In Southern Nevada, we've had, there was one center here that I think they were bringing in about 500 people and they were going to start it here, but there were sites all over the country that were part of this big national trial. The challenge with vaccine trials is you have to vaccinate a bunch of people and then see what happens over a few months. They have to be naturally exposed to the disease, and you're comparing them against unvaccinated people so that you can say the vaccine actually worked and actually prevented the disease. It takes time to have that exposure where you can actually see a difference. So that takes time to begin with. Then you have to analyze it and go through all the approval process and produce the vaccine and get it out. And that's assuming the vaccine actually works. Just because something started a clinical trial doesn't mean it's necessarily going to finish it. Plenty of vaccines fail. We see this all the time. We have, just over the decades, we've had a lot of hope going into the stage 3 clinical trials for a bunch of HIV vaccines. and none of them have panned out. It's gotten to the trial, and it just hasn't shown that it will protect people. And so hopefully that's not the case here. But if everything goes right, it is still a long process, which means by the time we're giving this vaccine to people, realistically, it's going to be into next year, because we're still doing the clinical trials right now, and we're coming up on September.
So if you think this through, we've talked about a vaccine, we've talked about convalescent serum, we've talked about all these other possible approaches. We don't know how long immunity lasts. The one thing that we know that works right now, cheap little mask.
Yeah, and I actually have my my Chicago Cubs mask shirt on right now. So.
There you go. There you go. Yeah, if we could just stick to the script and remember, the whole idea is to get everybody back to work, not open up, but to stay open. The idea to go back to work and stay at work and not have to worry about when the next wave comes. We know this much. In that, it was a great book, the Great Influenza, talking about the 1918 pandemic. These doctors set out, and they're great immunologists. They know as much as the world knows at that point. But they go to the first army base, and there are hundreds of men who are dying. They'll die within a single day. This disease is so virulent, it kills everybody in its wake. The doctors are standing over the dead and dying. In 1918, witnessing the genesis of one of the great kill-offs of all of humanity and all of history. They have one thing. They all walk in with masks. They're all wearing masks. They all lived to write the book about how to deal with the pandemic. Some things, in the end, are self-evident.
Yeah, and some things never change. We have certain things that we recommend in every single outbreak. It comes down to staying away from other people. If you have a disease that spreads from person to person and you're not near other people, you're not going to get infected. So every single outbreak there, social distancing winds up being part of it. Whether we talk about that or not, we do kind of discuss it in flu season, not to the extent that we do now. And the other piece is hand washing. In this case, surface transmission really isn't the biggest mode of spread, but it does account for some of the cases. And so hand washing is something that's been around forever, and that will allow or reduce some of the transmission of disease. And when you have nothing else, those basic things can go pretty far in actually helping us to control an outbreak.
I go along with your theory in your article regarding masks, and that is a lot of the people that refuse to wear masks also refuse to wash their hands while they're in the restroom. There's a lot of overlap there. I hate to say it, but I believe it to be the case.
I wouldn't disagree with that. And I think one of the problems we see is these social distancing things go together as a package. It's not like you're just going to do one of the things. We're asking people to stay home, and if they do go out, stay apart and wash their hands and wear masks. And people tend to follow all of those things or kind of follow none of those things. And so you get a big combination of all the bad things happening to some people, and then some people following all the recommendations at the same time. And that's where we start to see the problems. If you're not wearing the mask, you're probably not staying at home. You're probably not staying apart from other people. And all of those things come together to allow for disease transmission.
Dr. Labus, thank you so much for joining us today. We really, really do appreciate it. And we hope that we'll have you on again, that you'll be able to take time to join us again at some point.
Oh, sure. I'd be happy to do it. This is fun.
Thank you so much. Before we close, I do have something I would like to add. This isn't from Dr. Labus or from Vegas Legal Magazine. This is from me, Mark Fierro. We mentioned earlier the question fathers got from their kids, what did you do in the war? The honest answer from far too many people today, I'm afraid, to what did you do when COVID, the greatest threat to America, came? The resounding answer from those people will be, not a goddamn thing. I have my rights. You know what? Maybe you do. Maybe you do have the right not to wear a mask, not to lift a finger to help your country. But you need to know you are crushing the greatest nation of our times because you have rights. Maybe you do, but I guarantee you the judgment of history will not be kind. The Vegas Legal Magazine podcast, sincere thanks to Dr. Brian Labus, Assistant Professor of Epidemiology and Biostatistics, University of Nevada, Las Vegas. Special thanks to Tyler Morgan, publisher of Vegas Legal Magazine. Remember to like and share the Vegas Legal Magazine podcast on Facebook. Also catch us on YouTube, iTunes, or Stitcher. For all of you out there with an idea, a story, an axe to grind, get a hold of Vegas Legal Magazine, the leading magazine in Southern Nevada legal market. You can call Tyler Morgan at 702-222-3476. Reach out, tell us, tell your friends. Have a good one. We're out of here.